everyone, and welcome to this interview with Mieke Hoogkamp-Korstanje. Mieke is a prominent figure in the field of pediatric infectious diseases with a distinguished career spanning several decades. After completing her medical microbiology training in the Netherlands, she played a key role in developing treatment guidelines for infectious diseases. Now, for WSPID, in 1994, Mieke was approached by Napoleon Gonzalez to help establish the World Society for Pediatric Infectious Diseases, where she became one of the permanent international delegates. And she went on to serve as secretary of WSPID for a decade, from 2000 to 2011. She's been instrumental in organizing several WSPID meetings, and her efforts have bridged the gap between global healthcare challenges, the medical community, and pharmaceutical companies. Her contributions have definitely made a lasting impact, and her leadership remains an inspiration for future generations of healthcare professionals, including myself. So let's dive right in. Starting with our theme of 30 years of WSPID, my first question to you, Mieke, is about WSPID 30 years ago. What were some of the key challenges WSPID faced in its early years?
Well, as you said, I met Napoleon Gonzalez from Mexico during the ESPID meeting in '94 in Budapest. I was secretary of ESPID that time. He asked me, shall we create a World Society for PID? I said, great. He and Phil Brunel, a colleague in the USA, went to a notary in Washington and registered the WSPID in '95. 1 year later, Gonzalez organized the first WSPID Congress in Mexico. It was a 5-day meeting from 8 in the morning until 6 o'clock in the evening. And it was an overwhelming Mexican and American party, with Gonzalez and 2 other Mexican colleagues in the board. We were there with 25 ESPID members and had 1 symposium. We, ESPID, and other societies were not or hardly involved in the organization of the meeting, and cooperation was not on the agenda. 3 years later, in '99, in Manila, we had the same experience with the same board. So the main issues in the beginning were how to create a balanced society with an international board and give room and responsibility to other partners. How support and exchange knowledge and cooperation in the field. The other problem was how to control financial matters. In 2002, in Chile, a more international board with the representatives of all big societies, intercontinental societies, was formed. I became the secretary, and the organization and financial control of the meeting was given to Kennis Congress Office. This gave us the room to focus on the goal of WSPID, namely cooperation worldwide and exchange of knowledge. So in Chile, we visited hospitals and local colleagues, had discussion parties, and prepared fellowships in other countries. There we were also confronted with other diseases, other protocols and therapy. And I think that was a very good result of the Chile meeting.
Do you feel that this getting to know local practices, was that a big part of your aims in those early years?
Yes, that was a good idea to see colleagues working in the field in the countries we visited. That gave you a total other idea of what was necessary, and not only sitting together in a big congress center and hear what American or European have to say.
Yeah,
That's different.
yeah, that's very interesting because I suppose. So I myself work as a pediatric infectious disease an immunologist, and I work across 3 countries. So in the Netherlands, in the Caribbean part of the Dutch Kingdom, and South Africa. And what I'm realizing now that you say this is that whereas the world for us has maybe become quite easy to reach because of all the internet connections, and it's fairly easy to just get in touch with a colleague in another country to just ask them about their practices if you're facing difficulties with the patient, right? But I suppose that wasn't as normal in the times
No,
you
no,
are talking
oh,
about.
no,
So then it
no,
maybe
no.
becomes even more important to use those opportunities to get to know each other's practices, right?
Yeah, yes,
Yeah. So did that also mean that you deliberately chose the locations of the conference to get to know that society in that country?
yes, yes, correct. Yeah.
Yeah. Great. Thank you for sharing that. So maybe moving on to the perspective of the practitioner in those days. So as a pediatrician or as a clinician, what challenges did they face or did you face when diagnosing and treating pediatric infectious diseases?
Well, 30 years ago, we were faced with new antimicrobial agents like the quinolones, new cephalosporins, antiviral drugs, AIDS, antimycotics, etc. The effectivity of therapy increased as also the risk of resistance to antibacterial and antiviral agents. 30 years ago, pediatricians in most countries had no special training for PID. The role of the medical microbiologist and epidemiologist is an important one in treating infections. Cooperation with these specialists, daily contact, regular visits are very useful and appear to be of great value in diagnosis, therapy, experience, and evaluation. I think that was a great goal and also a great step forward.
What role could an organization such as WSPID play in that, in those challenges? How
I
did it
think
help you personally, for example?
I think the role of cooperation and recognizing the problems in the field, not at your bureau, going with your colleagues and colleagues in other countries have other problems. I know the problem of resistance in South America was enormous. They started for little girls and boys started every day with antibiotics without diagnosis of any infection. And so the increase of resistance was enormous there. These are things we have to focus on and to recognize.
And when you say recognizing, do you mean also advocating maybe for changing some of the practices?
Sure, sure, sure. I think there is more interesting in PID since 30 years. Wars, refugees, and pandemics have changed the world, and the impact of infectious diseases is enormous. Think at corona and its influence on daily life worldwide. So every physician, to my opinion, will be confronted with infectious diseases today. And when I look, honestly, to television, news, and so-called experience, then is training and education of infectious diseases still very much needed.
Yes. Yeah, you mentioned training and education before, and I suppose you have a warm heart for that part as well. Can you tell us a little bit about how that has evolved over the years?
Since the big pandemics, there's more interest in infectious diseases all over the world that is recognized. And I think the role of the medical microbiologist is rather important in this, in cooperation with hospital people, national health organizations, etc. I was always in the hospital. Many people thought I was a pediatrician myself, but I wasn't. So training, global contacts, fellowships, modern media, courses, and exchange of knowledge may help uh, to confront with this problem. Yeah.
Yes. Yeah. Thank you. Yeah, I can see you feel very strongly about also the physical interaction, like actually being in the hospital together and managing
Oh,
these
sure,
cases together, right?
sure, sure.
Not
I,
just
and
doing it from the
I think,
lab in
oh,
your position.
yeah, no, no, not only on the lab. Lab is beautiful, surely. But yeah, I was every day also in a hospital. I started in the lab, and then at 10 o'clock or earlier, I was in the hospital to cope with the colleagues. I think I will also plea for cooperation with pharmaceutical industries. They are not only sponsors for us. It's not only the money. I think they are partners for us. They can create new medicines, and they need us to test, to do the research in hospitals with them. I always was very eager to have a good contact with the big companies and on that field as a partner.
And maybe moving back to the part of the training, because I think one thing that WSPID is also feels very strongly about is facilitating pediatric infectious disease training in low middle income settings where that training is often not regulated or recognized as such. What do you feel would be appropriate training for these countries? Currently, there's often like quite a training on the job perspective that people take. Or they may go to other countries as part of their training, but then the disease prevalence in the country that they train in may not be similar to the disease prevalence in their home country. So, what role could an organization like WSPID play, in your opinion, in organizing or facilitating pediatric infectious disease?
I think ESPID can help for these global contacts. Can invite young people from every country and with courses, modern media today. So exchange of knowledge can be helped by these new challenges. And I think, yeah, my advice is become a member of any PID society in a country where you live. Follow the courses of WSPID. Try to organize fellowships for the guys in other countries and listen to medical microbiology.
Yes. Thank you. That we will definitely take that advice to heart. And maybe just a more like medical question, because you spoke earlier about antibiotic resistance and the importance of recognizing that and recognizing how that was linked to daily practice. Can you think of another like medical breakthrough or turning point in the field of pediatric infectious diseases that really influenced your and our daily practice?
Yeah, difficult to answer. The circumstances for any people are different in different countries. Yeah, one cannot compare the problems in South Africa with those in Holland or with those in the Philippines or South America. They are different. Therefore, it's important to speak with each other, to go there, to see what the problems are. I think resistance to antibiotic is not an item in South Africa. There they have AIDS and the problems of therapy for AIDS and the other diseases than we have, than we are confronted with in our hospitals. So go there and try to cope with these colleagues.
Yeah, so what I also hear you say, it's important to just get to know the different settings and
Yes,
liaise with local people to see which are
yes.
the issues that need to be addressed, right?
Yeah, I think we are not the messiah to come to less developed countries and help them. That is not realistic.
Yeah, I think that's a very important perspective you're bringing. Um, and it also says something about, I think, WSPID's being a bottom up organization, right? People bring to the table what's happening in their settings. And then make use of the network and the connections and the
Yeah,
expertise to try
yeah,
and
and
improve
that's
their own setting.
expertise of the colleagues. Yes, yes, that's right.
So I have a last question for you, and that's because we know that there will be pediatricians that just got out of their training or young pediatric infectious disease specialists seeing this. And I was just wondering, what advice would you give them if they are starting their career in pediatric infectious diseases today?
Go to the field. Go to your colleagues in other countries. Go to the laboratories and visit them. And yeah, I think a broader aspect of the disease can be collected in this way. And then, so you can face the problems then at locals.
Yes. Thank you very much. That was very insightful. I'm just wondering, in addition to what we all mentioned so far, do you have any particular memories of like WSPID events or people within WSPID that you would like to share with us?
I had a very good contact with all my colleagues and was happy to serve the board. After the 2002 meeting in Chile, we had also always a board with colleagues from all intercontinental countries, not only from Mexico, as in the beginning. And that was very worthwhile. I liked that. And I had a great time with WSPID until I stepped out in 2011.
Yes, so and maybe I can share some memories that I have, more recent memories, definitely, and see if you have any advice for us. So, a couple of years ago, we founded Young WSPID. So basically, within WSPID, we said that we would like to sort of gather the young pediatrician infectious disease specialists in training or pediatricians that were still looking to see where they would do that training to become part of the young WSPID community, with the idea that we could also maybe foster relationships within this more junior group to see how we could help each other out and also sort of be the voice of the trainees within WSPID. It was quite the process to get it set up, to connect with everyone, because then we also noticed that everyone was still obviously busy doing their own training and the clinical caseloads and trying to set up the research lines. And I suppose it's a phase in your life where a lot of things are happening. But we did build it into a large network of trainees within WSPID. And I feel like we can now also use that network to sort of advocate for the rights of trainees.
That's great. Great what you did. And I heard this from Ronald de Groot, who told me that the Young WSPID was really a success. And I hope, that's the future for WSPID, of course.
So I feel honored that our activities have apparently also reached you then at some point. Yes.
Yeah.
Is there anything else you'd like to ask me?
I feel honored with this interview.
Yes, great. And maybe just from the perspective I finished my training as a pediatric infectious disease specialist 2.5 years ago. And as part of this training, I was working in these 3 places that I mentioned before, so South Africa, the Caribbean, and the Netherlands. And one thing I've learned is that taking care of patients with infectious diseases is not always the task of a pediatric infectious disease specialist. It's a team around the specialist, including the medical microbiologist, but it's also quite often the first person that they will see is a general pediatrician or is a pediatric registrar, is someone doing an internship. So it's really also about the whole group of physicians taking care of pediatric infectious disease patients, right? So I was just wondering, like in the early years or thereafter, is there within WSPID attendance for fostering collaboration between like general pediatricians and pediatric infectious disease specialists, for example?
Oh yes, I would promote that. Yes, that's a good idea.
Because we may not always sort of target that group of pediatricians as well, right? When we focus on the pediatric infectious diseases, while they can be the first ones to be confronted with the patient.
Yeah.
We'll see
Okay.
if we can get that little piece of advice back to the board.
Okay.
All right, we're going to wrap up. Thank you very much again, Mieke. I feel like we
You're
can
welcome.
talk for some more time, which we may do outside of this episode. But it was very nice to hear some insights from you and to get a bit of perspective
Okay.
about the early years.
It was a pleasure.
Thank you.